In this presentation, I will share some images of hysterosalpingography of Asherman syndrome and compare with 3D evaluation. Patient was a 27-year-old Parawan alive whose last childbirth was 12 years prior to presentation. She is in a second order of marriage, now in its 10th year, being managed for infertility. She had a first trimester miscarriage at about 8 weeks of gestation, about 12 years earlier. HSG short uterine synechia. So this presentation will compare the HSG image with 3D unenhanced endometrial assessment. So this is the HSG image, and this is the report of the HSG. The outline cervical canal and the uterine cavity are irregular, suggestive of synechia. Both fallopian tubes have been outlined with free peritoneal spillage. So this is the image of the HSG, and this is the report. So this is the 3D image. As you can see here, the endometrium is thin. Look here, endometrium is irregular, number one. Number two, look at these bands crossing the endometrium. In fact, one can even measure the thickness of these bands. As you can see, this band here is thicker than this, and this is thicker than thick. This. So now let's compare the HSG and 3D and see which one is more informative. Here you can see the irregularity of the uterine cavity, yes. What about here? You can see not only the irregularity, you can see the bands. And you can count the number of bands and even measure the thickness of the band. So here is normal endometrium. See this? See part of the corner here. So now compare with this case of intrauterine synechia. Better still, if you have the facility for 3D, you can also do saline infusion sonography and look at this normal endometrial folds, the balloon catheter here. So this is from my book, Summary of Endometrial Adhesions, that SIS is the best imaging modality for detection of intrauterine adhesions. But the gold standard for diagnosis of endometrial lesion is hysteroscopy. Over 90% of cases of Asherman syndrome occur after pregnancy-related curettage, as in the case presented. Let's remember that pregnancies following intrauterine adhesion should be managed as high-risk pregnancy. At times, all you see are actually bright dots, but commonly thin or thick echogenic bands are seen, which are attached to the endometrial walls. So why is 2D SIS the first imaging modality of choice? Look at it. Pediatric folate catheter, look at well distended endometrial cavity. So if there's any lesion here, the lesion will be obvious. So the first line non-invasive imaging modality for Asherman's is SIS using transvaginal imaging. So thank you very much for listening.